Coronavirus and race. That is the topic of our town hall tonight. Charles Benson and I back together again to talk about it and how it's affecting our city.
Yeah, good afternoon, Shannon. You and I have been talking about this since day one. The coronavirus does not discriminate, but the virus is causing a racial divide right here in Milwaukee. And we're going to talk about that, talk about why African-American communities are being more heavily impacted.
And joining us right now is Gina Green Harris with UW School of Medicine and Public Health. Gina, I think the question we start with is, why is the coronavirus ravaging the Black community?
Good afternoon. Thank you for actually allowing me to join. And I think that question is a very good one. And quite frankly, what we know is African Americans in our community and just some of the setups that we know and conditions that we've been facing over decades is definitely part reason why we are seeing the impact that we are with the coronavirus. Quite frankly, we know issues such as poor health conditions in African Americans with comorbid health diseases. We know the issues around racism, structural racisms that impede upon things such as the redlining that happens, housing, transportation, close quarter living. All of those are really proponents that further exasperate the issue of coronavirus in our community.
Yeah, so Gina, the history is long here and what we've seen leading up to this moment. So as we go forward, though, how do we correct those? What does it look like a year from now or even 3 or 5? How do we deal with this?
I think that's an excellent question. And for me, I think part of what we definitely know we need to do is what the community is doing. And that is coming together to address these issues that have been systemic and oppressing our communities for so long. So what I mean by that is, again, looking at all the institutions. For instance, our institution, the UW, and our partnership program has just put over $2.2 million of grants in the communities to address the issue around COVID, but doing so using a health equity and diverse equity lens. That's critical to the work that we're doing. And also looking at, I'm excited that we're acknowledging that race is a systemic issue in our community. So pulling those things together, what I think we can do is address the issues around poor health access, addressing issues such as joblessness, food insecurities, all of those things as we begin to look at programming, as we begin to look at building from within the infrastructures of the community to address these systemic issues, we will find ourselves, it is my hope, that in the next year, we will find ourselves in a better place. Now, we all know the gold standard is, of course, finding a vaccine. But beyond that vaccine, we're going to have to find systems that we can address these other comorbid conditions that are impeding upon this illness.
Can you briefly talk about precision medicine and how that can be vital in what we're doing?
I think actually it's really interesting. So precision medicine, of course, is where we're looking at individuals and helping them with their health outcomes. And as we know, I wear glasses, but my glasses only fit me. So my prescription is designed for me. Precision medicine is critical to making sure that as a community, we are being treated as individuals and not in generalities. And so I think that is going to be really important as we continue to move forward in the days to come. So we're excited about that initiative.
Yep, Gina, this is all good information, not something that can be covered in just 3 minutes. That's why, and thank you very much for joining us, that is why we are hosting a virtual town hall tonight at 6 o'clock right here on TMJ4 News. It will focus on some of the things you're talking about, on the medical, economic, and emotional impacts COVID-19 is having on the African American and Hispanic communities. We will also touch on how we can rebound from this pandemic.